So you've done some work in Jordan, and it is relevant to where we are today in America, working with Syrian refugees. And you had a hands-on experience with Syrian refugees and training people. Can you talk a little bit about that?
Sure. The lead up to the conference that I attended was that I spent 8 months teaching an online class for people in Jordan who were volunteering to provide crisis mental health services for the 500,000 Syrian refugees that flooded into their country. This was through a group called the Common Bond Institute out of Michigan. And I was asked to participate because a good friend knew that I was interested in teaching, that I'm interested in international work, and it just kind of clicked. Because of technological difficulties, a series of interesting things. They had the first snowfall they've ever had in 100 years. We had a tornado in Washington that kind of shut us down for a month. It took 8 months to complete an 8-week course. But these people were there every week when they were able. And so out of that came the invitation to, if I had the if I could afford it, to go to the conference, have a chance to do hands-on work with these people that had been on the other side of a recorder, and actually get some hands-on experience. My experience had been that these are very dedicated people. Most of them themselves are refugees, and they're refugees who have a background in mental health, but not a lot of clinical experience. Some of it's political, some of it's just the situation. But they are in there because there's a need, and their passion is to do what they can to help.
You were telling a story, and I think one of the points that might be important for people to hear and understand, you were telling a story about a Syrian refugee. Would you feel comfortable sharing that story?
Yeah, this is the first time I've been able to talk about it in its entirety. First of all, the setting is, this was at a Syrian American Medical Society office, which was staffed. They had a psychiatrist that rotated through various clinics. And prior to the refugee situation in Jordan, they had one psychiatrist in the country, which I think is really important. I work in a hospital where we have 6 psychiatrists available to us at any time, and one for an entire country. It was run by a psychologist and with a staff of line clinicians, master's level, bachelor's level clinicians. We met with the psychiatrist, the psychologist, my mentor, myself, and an interpreter, because everything had to be interpreted. Met with a gentleman who was in his early 30s. In Syria, his job had been he was a photographer. He loved taking good photography, good photographs. And his wife was raped in front of him, his son was killed, and he was beaten and left for dead. The assailants, the rebels, deliberately crushed his hands so that he would not have access to his livelihood anymore, and left he and his young daughter alive, and then went on about their business. He was found, and his daughter was sent to his sister to be cared for. He'd not had any contact with her since, and by his choice, because he didn't want to it hurt too much. And then he was taken to Lebanon, where he had a series of surgeries to try to reconstruct back trauma. I don't have my notes, I don't remember. And hands, and he'd had, I think, 6 or 7 surgeries at that point, and was in need of many, many more. And they were hoping to find some resources for him. after his wife was raped in front of him and his child was killed, she killed herself in front because she couldn't live with it. And when we met with him and the question was asked, what is it that you want? His answer was, I want people to know the truth. I want people to know that we're not like this and that we don't want this anymore.
Are you okay to keep going?
Yeah.
As you reflect on all the things going on in America with what's going on with how we're viewing the refugees, what's your opinion, having worked with many of these people and these tragic stories?
I think we are allowing ourselves to be frightened, and it's frightening. It's frightening to be faced with just how cruel people can be to other people. It's kind of like that book that we read in grade school, or high school, The Lord of the Flies, how quickly we can degenerate. And that is scary, and I prefer not to think about it, but the fact of the matter is it's real. Those people didn't ask for this. They don't want world domination. Most of those people want to be able to go back to living their lives in a productive way and not worrying about it. I think that we as humans need to be not afraid to reach out to other humans who are suffering. Number one, because of the price that I pay when I see somebody injured and don't, on a spiritual and emotional basis, if I don't help as I'm able. But also, if we want people to understand that there are better things, we need to make sure they have access to them. And I can think of no better way to foster resentment than to see somebody hurting and pay no attention. I think that this is becoming a political ping pong ball, which I resent, because these are human lives on the line. This is not an abstract concept. These are children. These are our mothers. These are our fathers who want nothing more for their kids than the health and safety that every child out on the street has the right to assume is there.
You had said when we were talking that you thought that the children are going to remember who bombed them.
Yep.
And who helped them.
Yep.
And that in not helping them, we create a bigger enemy.
I think that we are sowing seeds, and those can either be seeds that are going to grow into, these people saw my need and reached out for me, or these people turned and walked the other way. And this is a generation that 20 years from now will be making policy and will be in charge of resources that we would like to access. I just think it's very short-sighted. It's uncomfortable, but I think that there are things we can do. We can make an effort to get to know somebody, make an effort to get to know what the Muslim faith is about. I was scared to death, but a headscarf is a headscarf. The person underneath it is still a person, and they were some of the warmest, most welcoming people I have ever encountered, and they remain very good friends. Actually, I'm trying to work with my National Association of Social Workers to help establish and strengthen international social work abroad, and that grew out of this contact.